Having a test to measure your ovarian reserve is the start of the fertility journey for many different people. It might be that you just want to know where you are because you're considering freezing your eggs, or you might be planning a fertility journey as a solo mother or in a same-sex relationship, or it might be that you're in a heterosexual relationship and your partner's already had semen analysis and we just need to find out whether the egg reserve is good or there are some issues there. The test is very simple, and it is there to look at what your fertility is like right now in time. You are born as a female with all the eggs you'll ever have in your life in your ovary, and they do decline in numbers and in quality over your lifespan. So when we do a fertility assessment, we arrange for you to have an ultrasound scan of your ovary, where we will be looking at the number of awake eggs that are in the ovary at that time by measuring the little sacs of fluid that contain these eggs. These are called your antral follicles, and we count them on both the ovaries, and that's your antral follicle count. We also, during the scan, look at your uterus, the size and shape of the ovaries, and if there's anything else that might be impairing your fertility. And that might be things like small polyps in the uterus, or fibroids, which are benign tumours within the uterus wall, or it might be cysts on the ovary. Alongside the scan, we'll arrange for you to have a blood test which measures a hormone called anti-Müllerian hormone, referred to as AMH, and that is a hormone that's produced by the little sacs of fluid in the ovary and is normally very, very well correlated with the number of antral follicles we can see. If we pair up your antral follicle count and your AMH levels, they normally correlate very well, and they give us an indication of whether you're where you should be for your age in terms of your egg reserve, or whether your egg reserve is lower than we'd expect it to be or higher than we'd expect it to be. And that really gives us an indication of whether you should consider treatment, or whether actually you can be quite reassured there's no immediate rush, for example, to freeze your eggs. It's also very important because it gives us an indication of how many eggs we might get if we were to do something like IVF treatment or egg freezing treatment, where we use fertility drugs to try and grow some of these awake eggs to collect them. So it's a very, very useful measure. But remember, the egg reserve test is not really giving us an idea about your egg quality. That's much more determined by your age. As a woman with ovaries, you will find that your fertility does decline with age, particularly after the age of 35, when we start to see more genetic errors appearing in the eggs over time, particularly rising after the age of 40. I hope you found this video useful. We do have more information on our website, and we have regular webinars where we discuss the ovarian reserve testing in the context of fertility treatment.